Pyogenic meningitis, also called as bacterial meningitis. Etiology: the common organisms are Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenzae. The uncommon organisms include Staphylococcus aureus, Staphylococcus epidermidis, E. coli, Klebsiella, Pseudomonas, and the Proteus bacteria. Acute bacterial meningitis refers to inflammation of the leptomeninges and the fluid residing in the space that it encloses. As the subarachnoid space is continuous around the brain, the spinal cord and the optic nerves, the infective agent gaining entry to any part of it may extend immediately to all of it. Therefore, meningitis is always cerebrospinal. Meningitis can be acute or chronic. Acute is with the onset over hours to days. Chronic is when the symptoms last for more than 4 weeks. Clinical features of pyogenic meningitis include fever, headache, vomiting, these are the cardinal features, seizures, impairment of consciousness, photophobia, stiff neck, and stiff back. 3 patterns of onset are documented. Fulminant onset, that is, the patient becomes ill seriously within 24 hours. Meningitis developing over 1 to 7 days and associated with respiratory system. Meningeal symptoms after 1 to 3 weeks of respiratory system. In elderly, the signs of meningitis may be minimal, where low-grade fever and changes in the mental status may occur without headache or neck rigidity. Neck stiffness. This is when the examiner is unable to passively flex the neck and tuck the patient's chin on the chest. Next we have Kernick's sign is when the patient's hip and knee are flexed to 90 degree. It is impossible to straighten the knee to more than 135 degree passively owing to spasms of hamstrings. The Brudzinski's leg sign. Passively flexing the neck causes automatic hip and knee flexion. Investigations, you see increased total leukocyte count. CSF studies show appearance is turbid, pressure is elevated, cell count is raised, protein level is elevated, sugar level is decreased. A biopsy for skin lesion, blood cultures, radiography of the chest, skull, paranasal sinuses, CT scan, and lumbar puncture. Management for pyogenic meningitis. General measures to care for the unconscious patient should be started. Anticonvulsants are often necessary. Brain edema is best controlled with dexamethasone 4 mg 6 hourly. Herpes simplex encephalitis responds to acyclovir, and oseltamivir in influenzae is associated with encephalitis.